the GMMG-CONCEPT trial is a truly academic investigator-initiated trial, which I have the honor to lead this trial under the sponsorship of my institution, the University Medical Center of Hamburg-Eppendorf. And this trial started recruiting 153 patients in total in 2017, in the mid of 2017. And the aim of the trial was to investigate quadruplet treatment for patients with high-risk multiple myeloma. So it's a trial solely for high-risk patients. High-risk patients are defined by the cytogenetic features, deletion 17p, T414, T1416, and more than 3 copies, 1q21, and in parallel ISS stage 2 or 3 disease. And so accounting about 20% of myeloma patients. And the regimen consisted of Isatuximab as the monoclonal anti-CD38 antibody, which was just recently approved for the first time in the US in a pomalidomide combination for refractory myeloma. Isatuximab is combined with Carfilzomib, Lenalidomide, and Dexamethasone in induction, consolidation, and also maintenance in this trial. And patients can be included with a newly diagnosed myeloma and high-risk disease, and all transplant-eligible patients, so up to 71 years, also undergo a high-dose melphalan and autologous stem cell transplantation after 6 induction cycles with a quadruplet. And what we saw was that we shared now here the data on an interim analysis in the first 50 patients included into the trial, and we reported on the results of the induction treatment regarding response. And we saw that all 50 patients were evaluable for response. The median age was 58 years, with a range from 42 to 82. This was the oldest patient in this analysis population. And we saw that overall response rate, so partial remission or deeper, was 100%, and 90% of patients achieved equal or more than a VGPR, and 46% a complete remission or stringent complete remission. And in 33 of those 50 patients, during induction treatment already, MRD evaluation was performed with next generation flow and a sensitivity of 10 to the -5. And we saw that 20 out of 33 patients were MRD negative. So that quadruplet induction induces very rapid and deep responses. And we know that high-risk patients benefit from MRD negativity regarding progression-free and overall survival. Toxicity was moderate. Main toxicity was hematologic with a predominant grade 3 or 4. Neutropenia, non-hematologic toxicity was moderate. Main non-hematologic toxicity were infections. Especially we saw a very low rate of peripheral neuropathy with 16% all grades and no death on study. Despite that, were all high-risk patients. So that we think that our data underline what others also see, other cooperative groups, other sponsored trials, that quadruplet treatment is the new standard of care in treatment of newly diagnosed multiple myeloma, and that this especially accounts for high-risk patients, as they are even more in an unmet need to achieve minimal residual disease negativity. The trial is ongoing regarding analysis. The trial completed recruitment just recently in April, and we really hope that with our results we we contribute to a potential new standard of care for newly diagnosed myeloma patients.